Good afternoon and welcome to the Childhood Trauma Learning Collaborative Training, School and Community-Based Trauma Skilled Practices Supporting Youth, with the Director of the School Mental Health Initiative of the New England Mental Health Technology Transfer Center, Dr. Martha Staley, CEI Executive Director, Dr. Christine Mason, and Education Coordinator of the New England MHTTC, me, Dana Asby. My name is Dana Asby and I will be your webinar manager and host. Today's meeting will last approximately 6 hours with a 1-hour break and several mini breaks between. Microphones will be muted during the training portion of the day at designated times. For example, during our question and answer or shareback sessions, you can use the raise your hand feature to request an open mic. In breakout rooms, mics will be unmuted. When speaking, be sure to eliminate background noise. Thanks to a partnership with C4 Innovations, we're offering 3 hours of continuing education for both the morning and afternoon portions of the training. So if you remain on the platform for the full day, you will receive 6 hours of CEUs. We can also offer you a participant certification. For record-keeping purposes, you must identify yourself while on the meeting platform using your first and last name or email address that you registered for the event. You can either ensure your name appears as part of your video panel or enter it in the chat box now. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please send a private chat to Ingrid Paget, our technical support manager for today's training. We're pleased you joined the training, and I'd now like to introduce Chris Hallett, principal of Zippel Elementary School and executive director of the Northern Maine Educational Collaborative, who requested that we bring this training to Maine educators and community members.
Thank you, Dana. Good morning, everyone. Today, one of my co-leaders will be fellow leader in Maine, Julia Masick, a licensed social worker for 30 years, program manager at Aroostook County, also a leader in the Aroostook County Community Collaborative. Our presenters, Dana, who was just speaking, will be one of our trainers for today. She is the educational coordinator for the New England MHTTC and the director of innovation and research support for the Center for Educational Improvement. Youth from infancy to college age in classroom, homes, and other learning environments for 15 years. Dana transitioned into educational and mental health systems reform and research and training. And Dana is joined today by Dr. Mason and Dr. Martha Staley, who is the director of the School Mental Health Initiative at the New England MHTTC. She's also an instructor at the Yale School of Medicine, Department of Psychiatry. Martha has a background in integrated mental health and primary health care and mental health education in school and college settings. And Christine Mason is an educational psychologist and CEI's founder and executive director, as well as the director of the New England MHTTC's Childhood Trauma Learning Collaborative. Dr. Mason is nationally recognized area of educational reform, mindfulness, teacher mentoring, and special education, and has made more than 500 national, international, regional, and local presentations on this topic. Dr. Mason, over to you.
Thank you, Chris. And first, I just want to say it's such a joy to be with everyone today, even during this difficult time. So we're so pleased that you're able to be with us. And we know that a full day is a lot of time. So we do have breaks, and we hope you'll enjoy the opportunities. And I don't know what experience you've had with breakout rooms, but it's a marvelous tool, just marvelous. So we're thrilled to have that technology supporting us today. So I'd like to take a minute and recognize the facilitators who are going to be helping out today. Jill Flanders, Michelle River-Murphy, and Kathleen Sharapa have been working with me for probably the last 8 or 9 years. Jill and Kathleen worked with me when I was Director of Research and Professional Development for the National Association of Elementary School Principals. So they both have a background in working with principals. Jill was an elementary school principal focusing largely on early childhood for, I bet, 20 or so years. And then worked with the Massachusetts Elementary School Principals Association as their interim director. And she's now an early childhood consultant. Kathleen Sharapa is known for her work with principal mentoring. And you can think about that. Think about this time and the importance of having mentors and mentors for principals. And we just feel like this is a really, really critical function. In addition to that work, Kathleen works with universities and is a consultant, largely focusing on, again, the principal's role and what administrators can do to improve schools. Michelle Rivers Murphy is a co-author of mine. She's the Associate Director of Heart-Centered Learning. She has been an educational consultant and administrator, school administrator for many years. And she's helped, actually, both Jill and Michelle helped with some of the pilot work that has really established what we're doing today. So it's wonderful to have your help, as well as Chris and Julia, with us today. And Dana, do you want to spend a minute talking about social media?
Yes, and I'd also like to introduce one more facilitator we have with us today, Julia Masick. She is a social worker with 30 years of experience, and she also is a program manager at the Aroostook County Action Program, as well as a leader in the Aroostook Collaborative, the Aroostook Community Collaborative. So we're very pleased to have her here representing the agency side as well. And during today's program, we will be engaging on social media using the hashtag C-TLC Learning. So if you want to join us on any of our platforms, we're on Facebook, Twitter, LinkedIn, and YouTube, and we'll have one of our staff members standing by to answer questions, or if you just want to share any learnings or experiences. You can also visit our websites at the New England MHTTC and Center for Educational Improvement for more free resources on many of the topics we'll talk about today.
Here's a snapshot of this morning. So we're going to start with some background on what we know about Maine. And we're so pleased that during this meeting, we'll have educators working together with counselors, social workers, healthcare workers, community support providers, SRO officers, I believe, and I think we may even have a librarian and some healthcare workers. So it's just great to see the wealth of resources. And we have two fellows. We have a group of people we work with in New England. We call the Childhood Trauma Learning Collaborative Fellows, and they're also helping out today. We'll hear from them later this morning as well. So we're going to focus some this morning on collective trauma. And during these times, I think it's really, really critical that we do think about what we can do to support children and families and our own self-care as well. We have a model we've developed that we're just thrilled to present to you today. We have used it throughout New England, and it is a way of helping to bring more compassion to schools. We have a toolkit that we're going to share with you, a back-to-school toolkit, and other tools and resources. There's a process involving core learning teams we'll work with, and we'll show you some about visioning this morning, but return in the afternoon as well. And as you can see, in the afternoon, more work on visioning. The SK is our tool for measuring school climate and culture in a compassionate culture. So we're going to give you a chance to work with that this afternoon. And we want to tell you more about opportunities to be part of our Childhood Trauma Learning Collaborative.
So again, my name is Dr. Martha Staley, and I am the director of the School Mental Health Initiative for the New England Mental Health Technology Transfer Center. So I just want to go over very quickly about our goals for this morning's session, and then tell you a little bit about our collaborative and how we come to join you today in our work in Maine and in New England more broadly. And I'll go into a little bit more detail about that later, but for right now, our goals for this morning is to gain a better understanding of the neuroscience and neurobiology of trauma and the effects of trauma on the body, on learning, on ourselves, on our emotions, and how we function in the world. We are also going to spend some time talking about the work of the Childhood Trauma Learning Collaborative and our resources, and then take a deeper dive into our compassionate school mental health model and the implementation strategies for bringing compassion, vision, teaming and our tool to bear as you go back to work and are faced with the enormous challenge of educating children and helping your staffs to manage the events of the last 8 or so months. In the afternoon, we'll spend more time really taking a deeper look at visioning, looking at research exemplars. We will experience the tool, the SCATE, through a virtual simulation, and we will offer more concrete guidance about implementing these tools in your school and work environments. So we're going to begin first with just to get a sense of who's in our virtual room, all 93 of you so far, which is wonderful to see. Our poll question is, what is your job function? And let us know if you work with an educational system or an agency. So you'll see the poll on your screen and we'll be able to see who's in the room in real time. Okay, let's see. Almost 80% of you voted. So let's share those results. It looks like the majority of you, by a very slight margin, are school-based mental health professionals, very closely followed by teachers or school staff in some capacity. But it looks like we also have some school administrators and community service providers like nurses and police officers, which it's great to have you all here for that. And it's pretty even split between people who are coming from the educational systems and those of you coming from probably community agencies and nonprofit agencies. So that's, thank you so much for letting us know who you are and where you're coming from. That helps us have a better understanding of whom we're talking to. So I want to just briefly tell you what the Childhood Trauma Learning Collaborative is and what this big project, the Mental Health Technology Transfer Center, is. We're funded by the Substance Abuse and Mental Health Services Administration from the US government, and who funded regional centers across the country. We're in the New England Regional Center, obviously, and our collaborative is led by the Yale Program for Recovery and Community Health, of which I'm a faculty member of. And we are partners in this Childhood Trauma Learning Collaborative with the Center for Educational Improvement. And as I said, there are regional centers all across the country. So if you know a counterpart somewhere else in the country, you can let them know that they too have a center with this funny long acronym called the MHTTC. And there are also 2 additional centers that are not regional but national, having to do with the National American Indian and Alaskan Native MHTTC in Iowa and the National Hispanic and Latino MHTTC in Puerto Rico. So as we are beginning our work together today, I want for you all to just take a moment to look at our compassionate school mental health model. We're going to go into this in much more detail later on, but this is the frame that we'll be using in order to discuss some of our techniques, our research, the work we've been doing, and how it applies to the work that you all are doing in Maine. And this model really is a holistic model that deals with prevention, reducing the causes of trauma and mental health disorders in kids, supporting the child, whether in the school or in the community or in their families, building resiliency, increasing social emotional learning skills, building agency and health, and developing protective factors for kids and families and school staff. So as we're going through the morning time, particularly think about your function, your job, what you're doing in your schools or your community organizations or with your colleagues in terms of this model, these 4 dimensions. And we will talk more about this in a little bit. Okay, now another poll to get a sense of the populations that you're supporting. So in your work, are you working with kids who are living in poverty, whose parents have been or are incarcerated, children who are new to this country, new Americans, children whose parents are going through a divorce or a transition or unemployment or dealing with chronic illness, or who live in neighborhoods or communities that have experienced violence? In addition to thinking about whom you're serving, we also want to get a sense of whom you're working with. So are you working with a trauma-skilled or trauma-sensitive staff? Are you working with community partners to alleviate trauma and mental health challenges? Because those are the two components that we're thinking about today, whom you're serving and whom you're working with. So we'll give you a couple more moments to finish up that poll. It looks like most of you have voted, and not surprisingly, most of you are working with children living in poverty, but also many of you are working with children whose parents have been incarcerated or are currently incarcerated, which is certainly a special population that has been particularly traumatized. A third of you are working with new Americans, refugees, immigrant populations. Also, not surprisingly, you are working with children who are going through a transition, like a divorce, or who have experienced violence. And most of you are working with community partners to alleviate trauma. And those may or may not be trauma-skilled staff. It may be that you're in the beginning stages of doing that professional development. So thank you so much for letting us know a little bit more about who you are.